All right, good afternoon, committee members. It's 1:04. We have a quorum, and I will call the inaugural meeting of the Community Health and Wellness Committee to order. The first order of business is to elect a chair and vice chair, so we will call for nominations first of all for the position of chair.
Kermit?
No.
No? Why not?
Because I probably won't make all of the meetings, so Ron Kerr will be filling in.
Okay.
John Rice.
Dr. Rice, do you accept that nomination?
I do.
Okay. Are there any further nominations for the position of chair for the Community Health and Wellness Committee? For a third and final time, are there any nominations for the position of chair? Hearing none, we will elect John Rice as chair of the Community Health and Wellness Committee by acclamation. Next is to elect a vice chair. So we have nominations for a vice chair, please.
Megan.
Okay, somebody going to nominate Megan, or Megan, are you nominating? Okay. So Kermit to Megan Tomlinson. And you've accepted that nomination, yes? Okay. Are there any further nominations for the position of vice chair of the Community Health and Wellness Committee? And for a third and final time, are there any further nominations for the position of vice chair of the Community Health and Wellness Committee? Hearing none, we will declare Megan Tomlinson elected, acclaimed as vice chair for the Community Health and Wellness Committee. Over to you, Director Rice.
Just do it right from here. So I'd like to acknowledge that we're on the traditional territory of the Lakota people. Can I get a motion to adopt the public agenda?
So moved.
Carried. There's no business arising from the minutes. We have a staff report. Is somebody going to present the report? Okay, go ahead.
Thank you, Chair. Betty, I'll just grab the report, or sorry, the presentation. Oh. Thank you. All right, through the chair to the committee, I'd like to present to you some of the previous work that the Health Network Table of Partners conducted in their time supporting this work. So some background, in November 2023, the Table of Partners from the previous Health Network met with consultant Marcy DeWitt in a full-day session to discuss the Health Network's path forward. After long discussions, it was agreed that narrowing the scope while giving the ability to pivot amid crisis would provide greater resiliency and sustainability to the network. In 2024, the Table of Partners finalized their strategic priorities. However, this plan has not yet been seen or endorsed by the regional board, so this is it being seen for the first time. The mission statement that they agreed on was to improve the health and well-being of communities in the Strathcona region by focusing on upstream approaches centered on the social determinants of health. And their agreed upon guiding values were to exchange knowledge and build common understanding of the social determinants of health, strengthen relationships and build trust by recognizing the common challenges for Strathcona region, identify unique community development issues throughout the region, align around a common vision to amplify impact on shared priorities, and engage in collaborative problem solving throughout the region. They agreed that the strategic priorities of their work was the further development of the network. So network development, including collaboration, communication, information sharing, and advocacy. 2, relationship building and engagement. And 3, capacity and action on the social determinants of health. The health network strives to be the network of networks for the region. So to be effective in that, we must engage with periphery groups and organizations to clearly identify our objectives and cast a wide net to bring together diverse contributors. And this is just a list of some of the priorities and objectives that they had come up with during that session. Goal 2 was relationship building. Community engagement is a vital process that involves collaboration between organizations, First Nations, and community members to address issues, share information, and make decisions that affect the community. And effective community engagement helps build trust between government and organizations. It also empowers residents and creates sustainable solutions. Again, just a list of the priorities and objectives under this item. And thirdly, capacity and action on complex social issues or the social determinants of health. Many factors influence health, and in addition to our individual genetics and lifestyle choices where we are born, grow, live, work, and age also have an important influence on our health and well-being. So these social determinants of health refer to the broad range of those personal, social, economic, and environmental factors that determine individual and population health. And we know that some of these factors are already being attributed to projects within the Strathcona Regional District on projects like Recreate, where people can live healthy lives, and through the housing service, where people can have a sustainable place to live, and in other areas. So the goal of bringing this to this new committee was to learn if the committee sees value in what has the work that's been done, and if we can make some small changes, or if we need to go back to the drawing board. That's all for me.
So discussion, questions? Seeing none. There is options, so I'm not sure who would like to move one of the options. Oh, sorry. Can I get a motion to receive this report, please?
So moved.
Thank you.
Question?
There was no questions. They're just looking at the options before they move one.
Call a question on the adoption of the report.
Oh, can I call the question on adopting the report? All in favor? Thank you. Sorry.
I would move option B. There was one thing that I really don't support, and that was on one of the first slides where it, let me scroll through here. Or you can put it up on the screen.
Yeah, please.
Sorry, 1 second.
It said in one of the first slides to consult with business and build relationships with First Nations. That's the slide I'm looking for.
I think it was that one.
One before?
Yep.
Go back, Betty.
Go back.
This one?
You can control it now, I think. This one? Third one down?
Engage with the business sector, relationship building with First Nations. Is this the one?
Yeah, I think that we should be building relationships with the business sector, not just simply engaging with them.
So stronger language around relationship building with the business sector as opposed to engagement as it currently
Yes.
writes. Okay.
I just look at some of the things that have gone on in Campbell River lately where the business sector wasn't, I would say, fully involved in what was going on, like the movement of the kitchen and warming center, and now the difficulty that's being faced with finding a new location. And the reason for that is because the business sector was ignored when there was difficulties caused by the activities going on at those two places. I think that everyone would agree that we need a warming center and we need to have a facility for people to go and be fed. But it has to, be respectful of the neighbors. There was no good neighbor policy signed, and now if you went to any one of the neighbors that surrounded those establishments, none of them would agree to have it. If it was their choice, they would agree. None of them would agree to have that facility operating next door to them. And now I think that part of the problem when they go out and look for a new location, and they've had several landlords turn them down and say no, they won't rent to them. The reason is the reputation is already there, that they are not a good neighbor. So maybe if there would have been proper engagement in the beginning, we would have been able to find them a suitable location already.
I think you bring up a great point about that relationship building, and it certainly also sits within looking at the social determinants of health in terms of employment opportunities and income. So I think that relationship is a really valid one, so thank you for that. And I also just on that slide, as I was reflecting on it, noticed the wording specific to First Nations, and I wonder if there is, room or space for inclusion also of Métis, so maybe wording it as Indigenous partners would be more accurate.
Okay, great. And I've noted all that. So what I'll do is I'll go back and change those two things, and then if there's anything else, any other changes, like the naming, what else would need to change?
If I may, through the chair, we do have a closed session coming up, but these changes that are proposed at this committee level will have to be brought back to the more fulsome committee once we have our membership. So my suggestion would be that we make the changes that are provided through the committee today, and that those are brought forward once we have a more fulsome membership for further discussion throughout our committee membership. So anything else today that we have, we can then bring forward and review at that time.
Yep. Okay, thank you. So let's call the question. Did you have another question? No? Call the question on option B. All in favor? And that carries. So we're going to move into closed sessions. So can I get a report from the chief? Can I get a motion from to receive the report from the Chief Administration Officer?
So moved.
Seconder? Thank you. And can I get can I get a motion to move option B?
Can we call a question on that?
Calling the question on A first, for getting processed. Okay, all in favor? Can I get a motion to move option B?
So moved.
Thank you. So we're going to move the meeting to be closed to the public to consider matters to deem to fall